live. Bye. Okay, so there's a slight delay, but I think we are live. We're going to wait for somebody to comment and let us know that we are live. We will wait for, I think we're live, but you never know. Let's see. I think we're live. Okay. Okay, Christine, can you hear me? Can you hear me? Dr. Peat, can you hear me? Oh, can you hear me? You can't hear me? Why don't you try logging off and logging back on? Yep, we're live. I'm going to tell her to log off and log back on. And then we will see. It wouldn't be live without a technical difficulty. So let's just wait 1 second and see if we can get Dr. Peat back on. We were hearing each other just fine, of course, right before we came on. So let's see if she can log back on to our live. It should be the same link. Okay. Now can you hear me?
I sure can.
Yay. Okay. And you are coming up on our screen right now. So awesome. Welcome. You can hear me?
Yes.
Okay, perfect. Welcome, Dr. Peat. We are so excited for today's live. As folks kind of join us, be sure to say hi and where you guys are. Thank you for taking the time to join us today in our talk about COVID and eating disorders, specifically your research. So to start off, why don't you tell everybody about your role as director at the National Center of Excellence for Eating Disorders and what you do at UNC?
Yeah, absolutely. Thank you so much for having me this afternoon. I'm really pleased to be able to here to talk with you and everybody that's tuning in. As you mentioned, I currently serve as the director of the National Center of Excellence for Eating Disorders. And we're an organization that really is dedicated to providing education and training on how you manage eating disorders. So specifically, we work with physicians and nurses and other mental health care professionals so that they're equipped with what they need in order to provide the appropriate care to folks with eating disorders. I'm a clinical psychologist by training, and I've been working with eating disorders really for the entirety of my career.
And I have been lucky enough to call you an amazing and talented, intelligent friend for, I think, going on like 8 years, actually.
I think so. Yeah, that sounds about right.
You, Stephanie Zerwitz, and I connected on Twitter for a Southern Smash event that I hustled you guys into.
Yeah, absolutely.
So, yep. But it's really exciting to know that the research that you published, and so interesting how you guys got it published so quickly. So talk about the collaborative effort that NC did and the research that you all did very quickly on COVID and its effect on folks struggling with eating disorders.
Yeah, sure thing. And, you know, this is one of those things that I think has kind of been a little bit of a blessing in disguise when it comes to COVID. So we've had the opportunity to take on research projects that I just don't think ever would have happened without the ability to kind of come together virtually and kind of do things rapidly. But NCED partnered with the researchers at UNC Chapel Hill, in addition to our colleagues in the Netherlands, to launch a study basically looking at the way in which eating disorders might be affected specifically during this pandemic. So my colleagues, Cindy Bulick at UNC, Jet Termethausen, and Eric Van Firth in the Netherlands, really quickly pulled together a study protocol so that we could figure out, number one, how are people being affected by this pandemic? And then number two, what can that tell us as clinicians in terms of how we might best help people who might be struggling at this time? So we launched that, I think it was the beginning of April. And then we are collecting data for the next year. So we know that COVID is not sort of a short-term thing. So we'll be following up with participants for the next year, really kind of on a monthly basis to get a sense for what changes might be going on as different states or different parts of each country are opening up or closing back down, because we really want to give clinicians and other healthcare providers real-time information and data on how they can best reach their patients.
So what has the research and data shown so far, in terms of folks struggling, but also what I think the really unique aspect of this is how you can give this data into how clinicians can help, their client base?
Yeah, it's a great question. So, I think that some of what we've seen is a little bit of what we expected. So, given that people are spending increased time at home, maybe they're stockpiling food, kind of like what was happening at the beginning of the pandemic, there have been some really unique effects on people with eating disorders. So, we found that for people that have kind of binge type eating disorders, like bulimia nervosa, binge eating disorder, they're seeing an increase in their binge eating episodes. And then for people with more kind of restrictive eating disorders, maybe things like anorexia nervosa, we're seeing an increase in the restriction. And, what folks are really talking about is a concern about a worsening of their eating disorder because of living maybe in a triggering environment, because they don't have access to the same sort of support that they used to have prior to the pandemic, and maybe just kind of the other mental health effects of COVID, things like being more anxious, more depressed, things that we know that our patients tend to struggle with anyway. So, in some ways, it's been affecting people with eating disorders in ways that we would have anticipated. But having those actual data are so important. That way, we can let other healthcare providers and honestly legislators know that this is impacting people, and this isn't just something that maybe we're just seeing at UNC or just seeing at clinics in the Netherlands, for example.
Right. And to that point as well, with legislators, we want to also be sure everyone knows about the lobby day coming up in September. And I know our team will probably put up some information on how you can register for it with the Eating Disorder Coalition. And it's such a collaborative day that we can all come together and really make a difference on Capitol Hill. And so, I think specifically what was something really interesting that I read on one of your reports was the positives that have come out of the research in terms of family time, which is obviously not a positive for everyone, but it can be, and the self-care. I think maybe talk a little bit more into what have people experienced on the positive side of this pandemic in their eating disorder recovery.
Yeah, that's actually something that we were really pleased to have been able to include in the survey, because I think, especially as researchers and in eating disorders, we spend a lot of time kind of focusing on the negatives and the ways in which these conditions are really destructive to people's lives. But we also know that, sort of like what I talked about at the beginning, sometimes these really chaotic situations can have some positives that come out of them. So we just ask kind of open-ended questions about any positive experiences, either just in general or specific to the eating disorder that people may have experienced. And some of what we learned have been things like having that increased support during meal times has been really helpful for people. So, one of the things we heard from folks was that we weren't a family that was typically doing family meals, but now that we're all together and, there aren't these extracurriculars or other things happening, we're having nightly family meals. And that's been a nice way for us to connect. Or we've heard from other people, I haven't talked to some of my extended family members who live in different states in months, but now through Zoom and other kinds of, telecommunication, I've been able to connect with them. And that's been really lovely and meaningful for me. And I would say that one of the other major themes that we heard was that the pandemic has given people a little bit of a pause in their normal day-to-day lives and just given them a chance to slow down a little bit and maybe engage in some additional reflection that they hadn't had a chance to do. And that layer of reflection has almost kind of increased their motivation to work on recovery and to be working on their eating disorder behaviors. So I think it's so great that you're zeroing in on that and that there are positive lessons that we can learn from this.
So what would you, putting on your clinician hat, what would you think would be some great tips and advice on how folks, as we, some states are really reintegrating, whether we want them to or not, we're trying to get back to a safe life-ish, back to normal. So we're starting. How can folks that have struggled but have found these positive aspects of extra meal support, family time, self-care, how can they continue that? Because life is eventually, hopefully when the pandemic ends one day, get back to normal. What are some really good advice on how they can keep that motivation going?
Yeah. I think that one of the really unique things that has come out of all of this are sort of all the different programs and things that have now been sort of released online. So I'll give a great example. The Alliance has done some really beautiful work in transitioning their previously in-person support groups into an online space. And although there are some pros and cons to that kind of approach, it also allows people to access support in ways that maybe they didn't have a chance to because of the geographical limitations. So I would say one of the main things is finding those kinds of outlets for support that are available, because many places, not just the Alliance or not just UNC, are going to be offering virtual options for treatment, for support, all that kind of stuff, probably for at least the next year, if not beyond, because who knows how permanent some of these changes will be in terms of being able to offer teletherapy. But I would say taking advantage of those kinds of support resources, they're pretty widely available these days. I think that's one really important thing. I think also, sort of this isn't rocket science, but maybe doing what has worked for you during this period of time.
Yeah.
If you know, for example, that early on in the pandemic, one of the things that was really important for you was to take that 10, 15, 20-minute walk around your neighborhood because you just needed to get fresh air, you need the ability to kind of just not look at the same four walls all day long, regularly scheduling in those kinds of things, having that sense of routine, relying on that handful of folks that you know are always there for you. I think that those are things that you can still carry with you, even as our world is changing in terms of opening more or closing more. Those are things that you can still rely on.
Absolutely. And I think, thank you for saying that about our support groups. They are so phenomenal in the fact that, you know, the team, we were able to switch to virtual overnight. And for those of you maybe not know, we have individual support group, virtual check-ins Mondays and Saturdays. Mondays is at 7 p.m., Saturdays 11 a.m. And then Wednesday tonight is friends and family. So any loved one, it can be a friend, a teacher, literally anyone is welcome into that space. And it's a really unique thing. And I love logging onto our virtual groups, because it's this, you have people from all over. And, you know, that was one of the huge things missing in my recovery, was a support system in terms of people that can sit next to me and go, me too. And now that we can offer this virtually, so that people that usually don't have these support groups in their hometowns can log on and be a part of it. It's absolutely phenomenal. And so I think there are a lot of benefits in terms of what the, you know, silver lining of the pandemic, and how we've now gone to like all the Zooming calls and everything else. And I'm curious, has your report, or maybe you as a clinician personally experienced, you know, the pluses and minuses of telehealth? And, you know, I know some people really like it, some people struggle with it. So maybe some advice from those struggling with it, but also like, what have you guys found in your research?
Yeah, you know, I think that that's such an important piece, that to highlight a couple of things here. Number one, it's incredible for organizations to be able to quickly transition what they were doing into an online space. I think it just shows how dedicated groups like the Alliance and other places are to staying connected with their patients, even at a time of great uncertainty. I think, you know, what we are learning about, at least with some of the research we've done, is that the majority of people that were connected with a treatment team before the pandemic, they have been able to stay connected with their treatment team, whether that's virtually. I think initially there were still a few folks that were doing face-to-face sessions. Some of that has changed as time has gone on. And they've been able to keep those appointments at about the same rate. So let's say that you were meeting with your therapist and your team roughly once a week prior to the pandemic. They're still continuing to meet with their team about once a week. The challenge, however, is that at least early on in this first set of data that we've collected, is that a good chunk of folks were saying that the quality, or what they perceive to be the quality of their sessions, weren't quite as good as when it was face-to-face. And, you know, unfortunately, our survey doesn't allow us to kind of really drill down into maybe some of the reasons that might be. But some of what we've thought about has been kind of the early nature of the data that we collected in, let's say, April-ish. At that time, not everybody had had the ability to move to something like a Zoom or a WebEx or something, and a lot of people were still having therapy by phone. And phone sessions, you'd lose a lot of communication when you can't see someone. And not that video stuff is perfect, but it can be tough, right? So it's possible that phone may have contributed to some of that challenge.
Yeah, I think definitely it's better at least when you can see
I lost
someone.
the audio again.
You lost it again? Can you hear me?
I can't hear you. Hang on a second.
Can you hear me? Can you hear me now? Do you want to?
I'm going to log out and log back in.
Okay, I'll be here. Okay, everybody, hang tight while Dr. Peat logs off for a brief moment. I don't know why we just lost her, losing her audio, but such is life, as we are discussing with COVID and eating disorders and how technology can be hit or miss at times. And I know we at the Alliance, when we do our lives, it's always hit or miss. So here, she is back, and I'm going to put her back on. Can you hear me now? Can you hear me? Can you hear me? Well,
this is a live event, y'all. Let's see, 1 second.
How about I can text you questions? Let me tell her. We're just gonna. Oh wait, she's logging back on. So stay tuned. If not, we can both log back off and see if we can get this back going on, because I know there's still a few more questions that I got that folks are wanting to know, not just from the research, but really real life applicable things that we can do as we continue in this pandemic when working on our recovery. Let's see if we can get her back on. So yes, as we all know, technology isn't perfect, but there are a lot of pluses to it. So I guess let me log off, maybe, if she doesn't log back on in the next couple minutes. And we will try this again, and we'll try to just wrap up. Oh wait, there she is again. So we'll try this one more time. Can you hear me now, Christine? Dr. Peat, can you hear me? No? Okay, we're gonna both log back off. So we will be back on in just a minute. So we're gonna log back off. And okay, let's give this a try again. Am I back on live? Who knows? I think it's still going. Okay. All right, can you hear me? Hey, okay, I'm gonna let her back in. I think I've been live like this whole time. We'll give this a shot for like the last 10 minutes or so. Oh, thanks, Joanna, I'm online. So before that, perfect example of how technology can suck sometimes.
Absolutely. Yeah. Not planned.
Well, at least we had the reassurance that I was not going to have two small humans coming in here asking for snacks because they're not here. So I at least have that like calmness about me. So I could care less if anything else goes wrong.
This is normal for pandemic times. You just roll with it,
just
right?
roll with it. What else are you going to do? So right. Kind of going back to where we were before you couldn't hear me, I was going to ask, putting on your clinician hat, how can folks, now that we've kind of gotten in a rhythm of our telehealth sessions and what that looks like, if they're still struggling with it, what are maybe some advice from your side of the couch on how they can improve and maybe get a little bit more out of their session if they're struggling with that Zoom or telehealth?
Yeah. That is, I love that question. And, this is one of those things I think that could be broadly applicable, whether it was via telehealth or even in your in-person sessions. I think it's important that you have good communication with your therapist. So I know sometimes when you're in therapy, if you're coming as the patient and you're there to receive therapy, sometimes it feels like, you're going to be the recipient of the therapy and that you're going to be able to kind of just receive the treatment in a way that you might receive a medication or some other kind of medical treatment. But it's really important that you and your therapist have a good connection and can communicate with each other openly. So if there are components of the virtual treatment that just aren't feeling authentic for you or that maybe aren't ringing true for you, I think it's important that you let your therapist know what you're struggling with. I'll give an example just to be concrete. One of the things that we have heard anecdotally from folks as a clinician is that they're struggling with having to see themselves on camera. So many of the video platforms require that you see your face, and some of them don't allow you to hide the self view. And for some of our folks, that can be really triggering. It's hard to sort of see yourself on video, to hear yourself. And that's not something you have to deal with when you're face to face with your therapist. So if you're finding that that's distracting or if it's hard in some way, it's important to let your therapist know, hey, I'm struggling with this while we talk. Are there creative things that we can think about doing to adjust some of this? And just letting your therapist know, because he or she may not be aware that that's part of why you're feeling disconnected or feeling off in some way. So I think, again, just being willing to be an advocate for yourself and to communicate honestly some of what you're experiencing in the therapy session can make a huge difference.
Yeah, and that's something that we hear a lot in our virtual groups is, folks don't want to see themselves, but for reasons we have to have their cameras on, and so we'll just have them kind of move it, so that they can still get a lot out of the group. And I think too, to your point about, being an advocate for yourself, Dr. H, our clinical director, who is this phenomenal, brilliant clinician, she said the other day in group, a group member brought up, well, I just don't want to make my therapist mad. And she's like, if you bring up something to me, I've never been happier. You will never make me mad. You will never upset me. That means you're using your voice. And so I just I love that, because even as I am a veteran at being on, a therapy couch, and I still get that oh, I don't want to upset her. And it was such a good reminder for me to say, I'm advocating for myself. And I think of all times in our lives, during a pandemic.
Oh my gosh, yeah.
This is so important because you have this one precious hour that's yours. And so you need to make sure that you're getting as much out of it as you can. Mm-hmm. So I think I want to kind of wrap this up with a couple things, but some of the questions that we got kind of all centered around, with all the stress and fears around COVID, what are some ways we can care for our recovery?
Yeah, I think that first and foremost, to the extent that you can, staying connected with your treatment team or some kind of support is crucial during this period of time. It is hard to recover from an eating disorder, even during non-pandemic times. And then we add in all of these other stressors, it just complicates things further. So staying connected with your treatment team, other areas of support. I would say also focus on the things that have worked for you as you worked towards recovery. So if you know that having a set schedule for your meal times has been really helpful for you, stick to that schedule. I know it can be tough when all of the days blend together, all of the hours blend together, but having that sense of schedule, that sense of, okay, I know I need to eat breakfast, I need to have my snack, I eat lunch around this time. Having that kind of structure can be really useful. Also thinking about ways to maybe work with your dietitian. So in this time when you may not have the full availability of foods that you typically do or that you typically choose from in the grocery store, are there other alternatives or things you could be thinking about for making swaps or other just kinds of accommodations so that you don't have that panic moment when you're in the grocery store or when you're at home and you're not quite sure how to put that meal together. So I think taking advantage of those kinds of supports and the treatment team that's been there for you can keep you successful while you're in this time.
I think that's so wise, and learning how, I think that's such a huge key of recovery is learning how to be flexible. And I know in my experience, I've discovered Instacart in the pandemic, and it's delightful. But again, you have to have some food flexibility when someone else is shopping for you, which I probably wouldn't have had early in my recovery. But now I'm like, okay, cool. So they had to give me white bread instead of wheat or whatever it might be. And you just roll with it. And so it can be a really great lesson in, that flexibility. And again, getting creative with your team and working on those different kind of nuances. So I think to wrap up, tell us a little bit about what you kind of expect or anticipate in terms of your research and how it will kind of unfold and come out, how it will be published, and then where everybody can find it and find you.
Yes. So as I mentioned at the beginning, we will be continuing data collection over the next year, and we will be publishing batches of those data because we're following up with participants once a month, basically from April of this year for the next year. So we'll batch those data and then publish those as we get them. I believe that the Alliance will have links to the first set of data that we have.
We'll be posting that in the comments.
Awesome. So that will be available, and those are public access as of right now so that anybody can read those and you can get a sense for what we're looking at. That really was a big goal of ours for NSEED, was to make sure that we got this information into the hands of people that needed it quickly. The other thing I'll just briefly highlight is that NSEED created 2 distillation documents where we have taken the really long, really dense research stuff and condensed it into easy to understand one-page documents. We created one specifically for healthcare providers and one specifically for patients and for families. So if you go to our website, which is nseedus.org, you can find all of those documents there. We have a COVID-19 page. You should pretty easily be able to find those resources. And you can use those maybe in discussion with your therapist or your other healthcare providers during this period of pandemic.
That's amazing. We'll definitely link to those too and put up your website on the comments. But thank you so much for joining us today and enlightening us with all of the research knowledge and just your amazing human self. I can't thank you enough for taking time out of your busy schedule to be with us today.
I'm so glad to have been here. Thank you so much for inviting me and for sticking with me through all the technical issues.
Of course, you know, it is what it is. But thanks everybody for tuning in. And we will also be following up with some of the lobby day information that we highlighted earlier. So happy Wednesday, everyone. Have a great day, and we'll see you next time. Bye.
Bye, everybody.